Okay, cool. Okay, now we're live.
All right.
Okay, so we'll just chat and then, whoever joins can join. And then, like I said, I'll just post it everywhere afterwards. So,
Sounds
okay.
good.
So back to the beginning. So thank you for being here, Adam, and taking time to chat and, share all your experience and your knowledge with the acupuncture profession. We really just need to, continue sharing everything that we've learned and know as much as we can. So I would love to start by getting to know you. I'm curious what got you into acupuncture and how long that you've been practicing, and everybody has such a cool story. So if you would share that with us, that'd be awesome.
Sure. Well, thanks for having me. I appreciate the opportunity. I got into acupuncture actually through Tai Chi. I had been wanting to study Tai Chi for years and finally broke down and took a class at a local Tai Chi center in Madison, Wisconsin. And learning more about Eastern philosophy was really interesting because I had a degree in Western philosophy. And so I was realizing that Western philosophy, while it's interesting, is a lot more academic, and Eastern philosophy to me just seemed very practical. Mm-hmm. And there was a lot of knowledge in there and information that I could use, daily to improve my life. And then I happened to move into an apartment that was across the street from an acupuncturist and ended up going in there one day and trying it out. And it really helped with my seasonal allergies. And I became friends with the acupuncturist, and it was kind of a place I'd go on Saturday mornings after the farmer's market. I'd take some pastries over and just kind of hang out and talk. And after getting to know Dan for a while, I realized that, my current job wasn't as fulfilling as maybe it could be. And so I looked into going to acupuncture school. And that was 2004, I think.
Okay, cool. Okay.
And so then I entered acupuncture school in 2005.
Okay. And then did you do it in the 4 years, or did you stay out in 4 years? It's such a load in 4 years.
I actually did it in about 3.5.
You're amazing.
I kind of just worked a little faster, took a heavier caseload a few semesters.
Wow.
and kind of got through it.
Wow. And then where did you go to school?
I went to AOMA, which is the Academy of Oriental Medicine in Austin.
Okay, Texas. Yeah. Okay, cool.
And
I've been there.
Yeah, it was a great school, wonderful teachers. And because in Texas, you have to pass the herbal board exam as well, I ended up, that school ends up teaching you a lot of herbs. And so went through and did all 4 board exams, and then came back to the Midwest in Wisconsin and started practicing in 2009.
Amazing. Okay, cool. So for everybody watching, I posted about it, but Adam worked in the ER in a hospital as an acupuncturist for 5 years and now works in inpatient care. So I'm curious, what led you to get into that? Because you opened up your own practice at first, right?
Yeah, I opened up a practice and just like you, found it really difficult in the beginning.
Yeah.
Experimented with different business models and different ideas, and then ended up moving to Minnesota to take a job in a different clinic, in a community acupuncture clinic, and applied to work at this hospital at Abbott Northwestern for a line of health 3 different times, and never got an interview, never got hired, and ended up taking a job as a research assistant doing integrative medicine research at the hospital. And kind of parlayed that and worked a sort of a back door into actually practicing within the hospital.
Mm-hmm. Interesting. I talked to Robin Adcock, who's out in California, who now has like a acupuncture program in the hospital. And she I can't remember exactly details, but she almost said the same thing, where like she was in the hospital for a while, I think like doing some just free acupuncture work or something. And then so she also got in the back door. So that's interesting that that's what you say too.
Yeah. I think sometimes you just have to be in the right place at the right time and to actually make opportunities happen.
Yeah, definitely. Yeah. Okay, cool. Okay. So you were just telling me something interesting about the research though. Will you tell everybody that's watching?
Yeah. So I started off doing integrative medicine research, and the department I was working in had just received a $2.5 million grant from NIH to study acupuncture and integrative medicine, because we also have massage therapists, we do aromatherapy, guided imagery, healing touch, all kinds of different modalities. And I thought, well, I'm not doing direct patient care here, but hopefully this work will be disseminated in the community, and it will maybe help the acupuncture profession as well as the patients, and maybe help other hospitals figure out how to expand their integrative medicine offerings.
Yep, for sure. Yep. And then it didn't even get published, you said.
No, so unfortunately, after the 5-year study, the hospital that I worked at sort of had a budget crisis and ended up shutting down the research department before anything could be published from that. We did publish one qualitative study, but that was more talking to administrators, nurses, doctors about their attitudes towards integrative medicine.
Oh, that's interesting.
Yeah, so that was interesting, but the data itself has yet to get published.
Man. I mean, do you think that's a little fishy, or do you really think it was a budget problem?
Oh no, I know there was a budget problem. Unfortunately in healthcare, it's a tough business, not just for acupuncturists, but for hospitals too. And I know the hospital that I work at, even though it's a nonprofit, we still have a margin of only about 3%. And so it takes a lot of resources to make the wheels spin.
Yeah. Well, oh man, that's like after 5 years of research, it's such a shame that stuff isn't published. Oh, it's okay. We're pioneering the medicine. Okay,
that's right.
So you were in the hospital, and then you went from the research into the ER.
Yeah, and that was still through the research department initially.
Okay. So you were doing research in the ER. Yep.
So, we decided to start a program to see if we could bring acupuncture into the emergency department.
Amazing.
The medical director of the emergency department was interested in having it. He saw that we had it in other places in the hospital and kind of questioned, why can't we have it here? And talking with my boss, and sharing kind of my approach to acupuncture. And a lot of it was kind of informed by the community acupuncture stuff I was doing previously, as well as the home acupuncture visits I was doing. That was sort of my other business I was doing on the side to kind of keep my foot in the acupuncture world. And I would share how I sort of use an iterative process where I put some needles in, kind of see how the patient responds within a few minutes, and then maybe add some needles or adjust the treatment in different ways. And we decided that sounded like a pretty good approach to bring to the emergency department.
Yep. Okay. And so were you the only acupuncturist treating patients, or were there other acupuncturists in there? You were the only one?
I was the only one. The other acupuncturists that worked on the inpatient team tended to stay to the inpatient, whereas the emergency department is technically an outpatient part of the hospital, but that was sort of never on their radar, never a department they really went to. Occasionally they might get called to go down there, but it wasn't definitely a standard practice. So I went down there and just shadowed and saw how the department flowed and figured out, okay, what do I have to do to make acupuncture fit in this environment?
Yeah. And then what did you figure out?
I figured out acupuncture in the emergency department is nothing like acupuncture in your clinic.
I imagine.
We all sort of, I think, had very similar training, and running a student clinic, and you see your patients, and you put on nice music and you dim the lights, and you put the needles in, you leave, you come back, and in the emergency department, that wasn't going to work. And so I really learned a couple, good skills, like how to be really efficient, how to use the fewest needles possible, because it's very common that I put the needles in and 2 minutes later they say, well, this person's got to go to x-ray. Okay. So I pull out my needles and let them go. And having worked in community clinics, you learn a lot of distal points. I use a lot of Dr. Tan and Master Tongue and things like that I find to be really effective. And so I just figured out that, keep the treatment short, keep them focused, and don't really try to do too much, find out what the patient's needs are and address it.
Yeah, yep, yep. Do you have like, can you list a few like different things that you treated? Like, what would they come in that you'd be like,
Oh, anything and everything.
yeah, I imagine in the emergency room.
Obviously, everyone thinks the emergency room is this place where gunshot victims and stabbing victims all come in, and while that may
Grey's
happen at
Anatomy.
some, uh, the one I worked at tended to still get quite a few people that weren't, I would say technically emergencies.
Yeah.
Uh,
Okay.
we tend to be sort of a primary care overflow department.
Okay.
People want to be seen now. They have a problem. They're coming in. And
Yeah.
so I treated a lot of very common things that, every other acupuncturist would see in their practices, like back pain, knee pain, belly pain. But one of the things that was really interesting was figuring out how much anxiety played a factor in the patient's, current state, whether it was making
Yeah.
their pain worse or their nausea worse or just making them more uncomfortable.
Yeah.
And
Yeah.
so
That makes
I
sense.
realized quickly that was another area, instead of just focusing on pain, when you can really help make the patient relax, it makes the entire experience better for everyone, the patients and the staff.
Yeah, 100%. I mean, and did you ever have patients that you would treat and then they'd be like, "Oh, I feel better now," and then they'd just leave?
Yeah, that did happen. Yeah, a lot of it depended on the provider, the emergency room provider I was working with. Um, in the emergency room, a lot of things happen really quickly. And so
Yeah.
the biggest metric for an emergency department is throughput, get them in, get them out, because there's always someone else in the waiting room or someone in an ambulance that's going to be coming in. And so that
Yeah.
real estate's a priority to kind of maximize. And so there were times where, some providers would order acupuncture, but they'd also be ordering all the pain meds and all the other, meds and tests all at the same time.
Yeah.
And so they might be getting acupuncture and,
Yeah.
IV Dilaudid at the same time.
Yeah.
But there were other practitioners in the department that were a little more conservative and say, let's try the acupuncture first and see what happens.
Yeah.
And it did happen, a fair amount where they would get some acupuncture and they would be good enough to be discharged after they'd been evaluated, made sure there was nothing seriously wrong with them.
That's awesome. Well
Yeah.
done.
Yeah.
And then, so when you were talking about there would be doctors that would order like acupuncture and meds and all that at the same time, what popped into my mind was, how did you have to deal with your ego in that situation?
Yeah, that's actually a good question because, when you're a sole practitioner in your acupuncture clinic, you get to call the shots, you get to do everything your way.
Mm-hmm.
And here it was just a lot of compromise and a lot of, I don't feel like I had to compromise my ethics or my morals or anything like that, but I had to kind of set aside what I thought an acupuncture treatment was supposed to look like and really just focus on using the medicine in that moment to help the patients feel better. And ego definitely plays a role because there's a lot of big personalities in an emergency department.
I imagine.
Especially the doctors. And, I think I went into it in the beginning really hoping through the research that we would be able to somehow address the opioid crisis, that we maybe, put a dent in that. And I realized very quickly that one acupuncturist serving 35 rooms in an emergency department, it was probably wishful thinking, but I wasn't going to change the culture overnight of relying on those medications.
Yeah, exactly. Yeah. I mean, it's all baby steps, but it's one step forward, and just the fact that you've done that now, is amazing, and you've successfully done that, so not only is it inspiring for other practitioners to do that, but like it's all planting seeds, and it's planting seeds for any of the doctor that you interacted with too,
Yeah. And that was the thing I guess I appreciate about that experience was really getting a chance to sit and talk to, the doctors, the nurse practitioners, the physician's assistants, as well as the nurses, the EMTs, and kind of, show them through example of how this medicine can fit into the world that they live in.
Yeah. Oh
And I
yeah.
and I think a lot of the doctors over time, really valued what I brought to the table and were
Awesome.
happy to use it on a lot of their patients. And I
Awesome.
think the challenge that we as acupuncturists need to keep in mind is, we think that all these things are logical. Why isn't Western medicine using more acupuncture to help?
Mhm.
And the problem is there's a lot of demands on everyone in healthcare. And one of the doctors I spoke with shortly after starting this program, I said, what do you think about acupuncture? He's like, yeah, it's fine. He goes, but you have to understand that I have 10,000 things going on in my mind, and you're number 10,000. And so
Makes
it was a healthy dose of humility for me to say, okay, that's right. And so what he said though is, but once I see you here in the department, just your presence, okay, now you've moved up to 5,000. And
sense.
so it really took my
Yeah.
persistence and
Yeah.
my initiative to kind of go around and look for patients to treat, not just wait for them to put in orders, but look at the
Love
track
that.
board,
Yeah.
see what conditions are coming through the door and which patients I think I'll be able to help, the most.
Yeah. Yeah. I love that. Yeah, and that makes so much sense because like we think we're just trying to like slide into the well-oiled system of Western medicine, but like
Right.
not quite like that.
Not quite.
Western medicine is a hot mess.
Pretty much. Yeah, they've got a lot of problems and they've got a lot of constraints and they have a lot of demands on them and their time. And so it really was about how do I sort of almost like sneak in
Yeah.
and give these treatments while everything else is still happening just as it normally would.
Yeah. That makes a lot of sense. Yeah, that's a really excellent point. Yeah. Hmm. So, okay. So at the end you did it for 5 years in the ER, right?
Yeah.
And at the end, why did it end? How come that program ended?
A couple of reasons. So I actually stayed 2 years beyond the research department closing down. Um, we had gotten some grants from different sources to do some studies in the emergency department. We published one study that was a observational retrospective study looking at pain and anxiety scores that I had collected before and after treatments.
Awesome. Yeah.
And then after the research department shut down, the department was still trying to grapple with how do we make this a sustainable part of the department?
Yeah.
And so we applied for a grant through the hospital foundation, and they were generous enough to fund my position for the next 2 years while we tried to experiment with, researching ideas of can we bill for this service?
Yeah.
Are there other funding sources? Are there other research opportunities? And unfortunately, in the end, after those grants ran out, we weren't any closer to solving the mystery of how to bill for it or how to make it more sustainable.
Mm. And so, how come you couldn't bill for acupuncture like we can bill for acupuncture?
Yeah, that's a good question. We kind of explored it, but unlike, when you're just in your own acupuncture practice and you can, fill out a form and submit it to the insurance company and all that stuff.
Mhm.
In a hospital, you have to work with the electronic medical records and the whole technology infrastructure that exists. And that was really, I think, one of the hardest things was to figure out, okay, who's going to be in charge of this? What technology needs to be in place for us to bill for it in this new setting?
Oh,
'Cause
wow. So you
we,
can't just like add it on to the billing that
no,
they're doing. What?
no. Yeah, because the situation that I worked in, the emergency room providers were a separate um, company that was contracted through the hospital. So they did their own professional billing for their services. The hospital only billed for the
Wow.
facility fees. And so there wasn't a place for another professional charge to be put in to the system as it was. And trying to either create it or connect with all the right people within the
Yeah.
hospital was pretty challenging.
Wow. Man. What's so this is fascinating, because this is all stuff we don't think about. We're like,
Yeah,
and I'm guilty. I'm like, let's integrate, but like, wait a minute, Alyssa, what does that mean exactly?
yeah.
And so, I mean, it's great, for everybody to be inspired and enthusiastic, but it's like when it really comes down to it, there's things as simple as, not as simple, as complicated as the technology in the computer system being able to allow us to build. Like, that's bananas to me, because it's like you need someone full-time working on that, but then it's like who's going to do that and how are they going to get paid? And that's just like one example of so much, that we need to overcome to be in that setting. So that is a fascinating point, because it's making me like rethink everything. I'm like, should we really try and be in a hospital? Should we have a separate hospital? Like, now I'm thinking everything, like.
Yeah, I mean, and that's the reality of, I think, a lot of hospitals maybe want to explore integrating, different services into their mix, but paying for it is always a challenge. And then, even the technology of placing orders. I mean, when I was fortunate because integrative medicine had been at my hospital since 2004. So there was a lot of infrastructure already in place. There was a lot of procedures in place that we could kind of play off of and use. But we also don't bill for it on the inpatient side. So it's, there was no model to just translate it to the emergency department. We sort of had to create it. And we realized it's a lot tougher to create than we thought.
Sounds like it. And so do you mind talking about how much you got paid during all this stuff in the ER?
Well, I collected a salary. I mean, I was just a salaried employee of the hospital, like I still am. So it wasn't based on my treatments at all. It wasn't like, we're going to pay you $10 a treatment or whatever. It was just, I was just an hourly employee like everyone else.
Oh, you're an hourly employee. Okay.
Yeah.
Okay. I don't know what hourly employees in hospitals make, but you don't have to tell us if you don't want to feel comfortable. But do you feel like did you make enough money to like make a living and feel comfortable?
Oh yeah. Yeah. I mean, I think between the research work I was doing and then translating and moving into more of the acupuncture practitioner role, our hospital recognizes the value of the degrees we've obtained and wants to compensate us, I'd say fairly for that.
Okay, good.
And that's the challenge, I think, for a lot of people is everyone wants to know, how do you get a job in a hospital? And the challenge is you got to figure out a way of really convincing someone that they're going to get a good return on their investment. Yeah. And it's not necessarily going to be in money, in dollars.
Yeah. So. Yeah. And so would you have any words or advice that you could give to acupuncturists about that?
Yeah, sure. So I think if someone's interested in working in a hospital, the first thing I recommend is just go talk to someone, just knock on a door. I did that right out of school. I went to a hospital that my parents go to that's in a small little rural community, excuse me. And I talked to an administrator and they were really interested in it. And I didn't know what that was going to look like. We had conversations. And in the end, I think they were looking for more outpatient clinic, offerings. Yeah. And it just wasn't a perfect fit for me. I didn't really want to live in that small town. And so I moved. But let's see, I don't know, 7 years later, I think it was, I met an acupuncture student at one of the local acupuncture schools, and she wanted to chat after this presentation I gave. And we kind of had a little conversation about, the future post-graduation, what she wants to do. And she ended up moving to that same small town that I had talked about, and she got a job working at that same hospital. So even though it didn't happen when I proposed it, 7-8 years ago, they were still open to it, and she, went and made it happen. So I think the first thing is really just having initiative and trying to figure out why you want to be there. Like, what problem are you going to solve for them? Yeah. Because we come in, I think we leave acupuncture school and we're like, we can treat everything. We can help, migraines, back pain, vertigo, all these different things. And you have to realize, they have meds for most of those things in a hospital. So why should they have you as opposed to just the standard care?
Yep. That's an excellent point. That is pretty much the main thing that I learned from the woman in Israel who, you know, they've had integrative medicine in their hospital system for like 25 years or something. Their
Yeah.
integrative medicine is mind blowing over there. And I was speaking with her, you know, about how do we, you know, really like get this going in our country. And she said that almost exact same thing, where she said, you know, you want to approach it as not saying that you can help with anything, but like talk to the Western doctors and actually ask them what they struggle with in treating their patients. So perhaps Eastern medicine can help there, you know, and go in
Exactly.
from that angle. Yeah.
That's exactly it. And in the emergency department, I kind of honed that ability to sort of realize like where are my strengths and where are my weaknesses. You know,
Uh-huh.
some conditions, while they can be treated effectively with acupuncture, it's usually more of a course of acupuncture over weeks, months.
Yes.
And so what I found was certain conditions really were not amenable to getting much relief with acupuncture in just one treatment.
Yeah.
But I didn't necessarily shy away from treating those patients. What I would do is go into it with, you know, I'd say realistic expectations, but I used it as an opportunity to educate patients. You know, every time I met a patient, whether they chose to receive acupuncture or not,
Mm-hmm.
was an opportunity to talk about the medicine, explain things, answer questions to people that maybe had heard of it, maybe didn't know anything about it. And it was just a good way to start a dialogue.
Yeah.
And it maybe, you know, wasn't their day to try it, but maybe in the
Yeah.
future they were going to.
Ah, I love that. Yeah, that's awesome.
And
And
that,
I
oh, go
go
ahead.
ahead. Oh, I was just gonna say, like, I bet it was, you know, like your authority was already raised because you were in the hospital talking to them. You know.
Yeah, right. And that's exactly it. I mean, when I worked in the emergency department, I wore a white lab coat
Mm-hmm.
and, you know, tried to sort of look the part that I belong there.
Yeah.
And you gain, I would say, immediate respect when you show up looking that part in that
Mm-hmm.
setting.
Yeah.
And, you know, I'd walk in and patients would start telling me, you know, all their problems about this, that, and the other. I say, you know, time out. I'm not the doctor. I'm the acupuncturist. I need to know some of these things, but I
Yeah.
probably don't need to know everything you're sharing right now.
Yeah. Yeah. Awesome. Okay. So wow. Okay. So then, okay. So after that, now you're working with inpatients. You've switched to inpatient care.
Yep. Yeah.
Okay.
And so now our inpatient team, which is quite a bit smaller as well as it used to be before 2016, because not only was the research department eliminated, but a lot of the integrative medicine practitioners lost
Ah,
their positions at that time too.
ah,
And so now we're kind of in this rebuilding phase of
yeah.
trying to get our footing and try to, you know, narrow our scope instead of trying to treat anyone across the hospital, which has 620 some beds.
Wow.
Um, you know, we've been sort of partnered with the oncologists
Mm-hmm.
and the Joint Replacement Center, where we've had a presence since I think 2009.
Wow.
And now we've started working with our pain team,
Mm-hmm.
that a team of doctors that really focuses on difficult pain patients throughout the hospital. And
Awesome.
so we're kind of playing to our strengths. You know,
Yep.
we're helping people with severe pain. We're helping people deal with maybe nausea and side effects of chemotherapy.
Yeah.
And we're also just helping people feel more relaxed while they're in the hospital.
Yeah.
And
Yeah.
that's kind of been my, you know, I don't know, it's a slogan or tag phrase, but I always say, like, I do three things in the hospital
Yeah.
with acupuncture. I provide acupuncture aspirin to help with pain. I provide acupuncture Ativan to help with anxiety. And I'm an acupuncture ambassador. You know, I get to go and educate, talk to nurses, doctors, patients, family members.
Yeah.
And in my work, I actually get to treat a lot of my colleagues. I get to treat nurses. I get to treat some doctors and give them that experience of what it's like. And after that, you know, some of them even go and seek out acupuncture on their own.
I love it. Yeah. I mean, you're really pioneering things for us. Like, thank you.
Yeah, well, I think it's kind of the way to go
Yeah.
is to share what we can do and what we can
Exactly.
bring to the table, and then use every opportunity to kind of demonstrate that.
Yeah, I agree. You know, I mean, that's a big thing that I coach the acupuncturists on is like, listen, just educate. Educate, educate, educate with, no agenda, not trying to get anything back from it, just educate, you
Yep.
know? Yeah, because that is a huge thing. A lot of people just don't understand acupuncture, don't know why to use it, why to go.
Yep.
So in your inpatient setting now, are you able to do like treatment plans and more things like that?
Uh,
It's still,
I don't look at it that quite that way.
uh
I take on a caseload, um, and I try to see as many of those patients as I can throughout the day. A
yeah,
lot of it depends on their availability, or,
yeah,
sometimes I go to see a patient and they're in, a procedure, or they're getting dialysis, or they're,
mhm,
sleeping or eating, or, a million other things.
yep,
So I come up with, I go in, I find out what their need is that day. I give them a
mhm,
treatment, and then I document everything in the electronic medical record. And then, if I go back to see them the next day, because a lot of my patients will be in the hospital for days, weeks,
yeah.
some have been there for months. And
Oh wow.
I wouldn't say I create a formal treatment plan, because I don't
Mhm,
know the next day if the problem's going to be the same, if there's going to be
yeah,
something new that's popped up. But I have, I think, in my mind, an idea of what I'm going to do,
yeah,
day to day, week to week kind of thing.
yeah, yeah. And you just kind of do as much as you can.
Right. And one of the things I sort of learned in the emergency department was pattern differentiation didn't really matter much. It
Yeah.
wasn't something I was going to spend a lot of time, working up, because the
Mhm,
odds are I might not ever see this patient again.
mhm,
And what's the value of me treating their yin deficiency in, this one treatment? And so I sort of looked at things more symptomatically, symptom relief. Let's take their pain, their anxiety, nausea, and see if we can't help that.
yeah, totally. Yeah, that's super interesting. And how is your position funded now?
It's the same. It's funded through the hospital. The hospital pays
Okay.
my wage.
Okay. Okay, cool. So that's great that they have continued to do that. You
Yeah.
know,
Yep.
I mean, that is awesome. Okay, cool. So do you have any vision for where this is all going for you? And in the hospital, or are you like trying to do anything else, or are you just kind of like planting the seeds, really, and like repeating what you're up to?
Yeah, I think it's a little bit of both. I mean, I think um, I always have ideas. That's there's never a shortage of new ways, I think, that we could offer our services, or new avenues within the hospital, or partnering with different teams. Like I said, right now we're kind of limited to the pain team, oncology, and joint replacement, but that's a
Mhm.
very small portion of the hospital. So, it's finding those champions, those people that are really interested in what you bring to the table, and
Mhm.
trying to make those connections. And so some of it's that long-term strategy of building relationships with different staff members, different departments. Um, but it's also recognizing that healthcare, and especially the hospital system that I work in, it's a big ship, and it turns very, very slowly. And so you
Yeah.
can have all these great ideas, and you can be really animated and really enthusiastic and say, hey, we need to be doing this, this, and this. And they're saying, yeah, we don't have the time, the money, or the resources for that right now. And so
Yeah.
you really have to be okay taking no for an answer, more
Yeah.
than you hear yes.
Yeah. 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 That's so interesting. Like, it's just so interesting to like just think about this on the inside. Like, really, there's so many challenges to making change within the system that's already set. You
Yeah.
know, I mean, whew.
Yeah, and that's the challenge. And I think the more you can think about the system as a whole, the better off you are to try to integrate into those settings.
Yeah.
Because if you really have to understand how the system works, and what are the constraints, and what are the problems, and then that
Yeah.
helps you really find those opportunities to insert yourself and
Yeah.
say, hey, look at me. I have the perfect solution for this problem.
Yeah. Yep. Yeah, exactly. Yeah, I think that's probably the most powerful way is to go about it that way and to bring them solutions for what they're struggling with.
Yeah, and when you see how the different parts of the hospital operate, you start seeing more and more of those opportunities.
Hmm.
And I talked to an anesthesiologist who, and I said, hey, maybe you'd be interested in doing some research around doing acupuncture, pre or during surgery,
Yeah.
to see if we could help with pain and
Yeah.
nausea afterwards, because that's a big problem,
Yeah.
controlling people's pain and nausea right after surgery. And the anesthesiologist was very open and said, you know what, I'm not really interested in research. Let's just do it. If we're going to, let's just get in and see what happens.
Yeah.
And that hasn't happened yet, but it's finding those people that are open and willing to explore that with you.
Yeah, definitely. And do you is it just kind of random who those people are?
Yeah, you're never going to predict or guess or know
Yeah.
who
Is it
who it is.
an age range or no? Are you seeing that there's no commonality? It's just all over the place.
Yeah, it's kind of all over the place. And a lot of it might be based on their previous experience with
Yeah.
acupuncture or a family members or some story. And so, really the thing is meet as many people as you can, talk to as many people as you can, let them know what you're doing, find out what they're doing, and figure out, is there an overlap?
Yep.
One of the
Exactly.
places that I've thought for years is just a no-brainer is with chemotherapy infusion centers.
Yeah.
You've got these people sitting in these reclining chairs for anywhere from maybe a half hour to 5 hours. To me, that looks like a community acupuncture room. And why are
Yep.
we not needling everybody? And, one practitioner could treat, most of the people in that room at one time, probably.
100%. That's a great idea. I mean, same thing happens in dialysis, right?
Yeah, exactly.
We're all just
So,
sitting there.
right. So you sort of say, I don't need anything special. I just need to show up
Yeah.
with my needles and a sharps container and
Yeah.
go. But you need what you really need is the permission or the invitation or the acceptance. And so that's where the work on the legwork really comes in. Is you have to just be diligent. You have to be persistent. You have to have these ideas, and you have to be willing to, talk to as many people as you can to try to make it a reality.
Yeah. And over and over and over again. Yeah. And be okay with that. And so, you then too have to really be on top of your mindset, and not letting things discourage you or take things personally, or any of that type of stuff too, I imagine.
Yeah, that's challenging.
Yeah.
We all
You're
have
human.
our minds set in our mind how we want things to go and how we think it should be,
Mm-hmm.
and we don't always get to do it that way. And so
Mm-hmm.
flexibility, is really, I think, the key.
Mm-hmm.
The other thing that I think a lot of people think about when they want to go work in a hospital is, oh, it sounds great, and it's, all these patients, at your disposal. But you have to keep in mind too that unlike in an acupuncture clinic where a patient may come in and say, well, I've been feeling pretty sick, or, I'm having morning sickness most days, or whatever it is. When you're in the hospital, you're actually in the room a lot of times while the patient is sick, while they may be throwing up, or, other things are happening. So you really have to be comfortable with all the different sights, sounds, and smells that you're going to experience.
That is an excellent point. Yes.
Yeah. And you also see people in these very vulnerable states where they're, they're in their gowns, they're got tubes coming out everywhere, and they're not feeling well. And so you're not really seeing them on their best day. They're not coming to your clinic fresh and just showered and ready to lay down and relax for an hour and have you do so. These people are doing, some of them are doing better than others, and some people are not doing very well at all. And so you really have to be, I think, mentally prepared going in that almost for anything.
Yeah, that makes a lot of sense. How do you take care of yourself? Do you do meditation? How do you release, what you go through really in that setting?
Yeah. My meditation practice is, comes and goes.
Mm-hmm.
Sometimes I'm better at it than others. I think I get a lot of benefit from just talking, to colleagues, to friends, just kind of, sharing some of what I experience and just kind of letting it out. Because if you try to keep it all inside, it can kind of eat away at you.
Yeah.
So finding that support network, whether it's a good group of friends or colleagues or a mentor or something like that, is definitely helpful.
Mm-hmm. Yeah. Mm-hmm.
And I think for me, it's also there's a lot of inspiration I get from my patients
Mm-hmm.
in seeing how they manage their struggles.
Mm-hmm.
And some, handle it with such grace and a positive attitude and a smile all the time. And other people really, let themselves kind of get down about it. And recognizing that both of those are appropriate and normal reactions, and that I'm going to have those myself. Some days I'm going to be more present, more engaged, more able to deal with those difficult things. And other days I just recognize, you know what, I don't have it today, and I'm going to be a little more gentle with myself and maybe not force myself to tackle some of the more difficult things.
Oh, that's great. I love hearing this. Your awareness and self-acceptance and how you self-soothe, like,
Yeah.
good
and,
job.
And it's also, lately it's kind of reinvigorated me to get back into working out with my trainer and doing more physical activity, because I see what happens when you don't. A lot of the problems that we all deal with are a result of people just being very deconditioned.
Yeah.
They don't have the muscle tone they need to, walk properly or support their backs or things like that. So a lot of the problems we see are preventable to some degree if we take care of ourselves. And so it's also a good reminder that, while I have the ability to do it right now, I should really take advantage of that.
Yeah.
And that helps me,
Yeah.
physically deal with it, as well as, emotionally and mentally. I think exercise is just, has such good benefits for us.
So good. Yeah. Yeah. Wow, man. You like, this has been fascinating. Thank you for sharing all
Yeah,
of this.
well, I'm glad, I hope it's helpful to somebody that,
I'm sure it will be. Like, there's been so many points to think about and think on, and it's just amazing work that you're doing there in the hospital, and you've been doing it for such a long time now, and it's just so interesting to hear, from the inside point of view, and all the stuff that you've been dealing with, and really the realities of what it's like in there and what's going on, and what really integrative medicine in that setting means, and what you have to really like figure out in that setting.
yeah.
I mean, man, it's got me thinking.
Yeah, and I think, that term integrative medicine, for a long time I wasn't sure what that even meant. And for
Yeah.
me, it was a nice opportunity working in the emergency department to really figure it out and create it myself.
Yeah.
Getting a chance to work, not just having a doctor put an order in for acupuncture and I go see him and I never talked to the doctor again about it.
Yeah.
There was a lot of collaboration. And so it really did feel like I was being as integrated into the department as I could.
Mm-hmm. Mm-hmm. Yeah. Yeah. And I love like how you were just a go-getter, and you looked at the charts and you looked at what was going on in there, and you just didn't like sit back, but you know that you had a lot to help and a lot to offer. So you went after it. It's great.
Yeah, and that was actually a lesson I learned from one of the social workers that I worked with in the emergency department, because I had found out they had social workers there for a while, and the first one they hired, I think, from what I heard, just sat in the office waiting for someone to call and say, "Hey, we have someone that needs a social work consult."
Yeah.
And after a while, they're like, this really isn't a benefit to the department. They're not utilizing this person. This person's just sitting around. And they said, instead of scrapping the program, let's maybe try another social worker.
Yeah.
And they found someone that was on the floor talking to, all the nurses, the doctors. "Hey, what can I help you with?"
Yeah.
And then over time, that's when they get to see, like, what's your skill set really involve. It's not just about what we might think a social work consult is. But they became invaluable to the department. And that's when I realized, and I haven't figured it out yet, but the goal really is, how do we make ourselves necessary, not just nice to have?
Yeah.
Because I think everyone thought acupuncture in the emergency department was nice, but it wasn't necessary.
Yeah.
And so it's like, okay, what do we need to do to change that perspective and make ourselves indispensable within some part of the hospital?
Yeah. Great question. Great question. Yeah. Yeah. I mean, phew, yeah. So you have to have a lot of confidence, if you're going to go into a hospital setting, I'd say, to work.
Yeah. And I don't think I necessarily had all of it in the beginning. And I
Mhm.
remember there was a patient I was treating early on who, um, I'd probably been treating patients in the emergency department for a couple of weeks, and I
Mhm.
was doing a treatment, and something really strange happened. The patient kind of, I'd put in all these needles, probably twice as many needles as I use now. And I thought, oh, this treatment's not quite right. And after, 5 minutes, I was like, I'm going to add one more. And I put yin tong in.
Uh-huh.
And, I didn't think anything of it. And all of a sudden, the patient had this crazy reaction where she kind of lurched up in bed and gasped for air. And I was like, I was not prepared for that. And I
Yeah.
took all the needles out. And uh, it shook my confidence for a little while. And I was like, okay, am I really the right person to be here? Is this the right thing? Am I doing the right thing by the patients? And
Yeah.
then I realized, you know what? All these things happen, to all of us. To
Yeah.
the doctors could have the same kind of reaction from a patient. So it just was sort of like get back on your bike and keep going. And over time you develop that confidence. You develop the, your little speeches that everyone, has the same question. You get really good at delivering the same
Mhm.
answer.
Yep.
But the one thing that having that experience really taught me was the importance of developing rapport with patients.
Mhm. Mhm.
When you have a practice, they're seeking you out, they're coming to you, and there's something about you that made them choose you. Maybe it was you're the only person in town, or maybe it's the proximity to their house or their work. But you get that opportunity to have a conversation, but it's kind of on your terms, it's on your turf. And here it's sort of the opposite. I'm going in as a stranger. They're expecting doctors and nurses to come in. They're not expecting acupuncture. And so it was, how do I sort of break that ice and get their trust really quickly to
Yeah.
allow me to give them an acupuncture treatment, something they didn't come
Yeah.
in, they didn't sign up for.
Yeah. How did you manage that?
I think it was just a lot of practice. And I think it's one of those things I realized we all have different skill sets. And for me, I think one of mine is I'm pretty good with patients. I know how
Mhm.
to talk to them. I can relate to a lot of different people. I can, use humor a lot of times to sort of
Mhm.
break the ice. And once you get people to sort of uh, accept that you're coming in, you're not trying to sell them something, you're not,
Mhm.
forcing them into something, you're just offering them something, and
Mhm.
it's something that's free. I think that, helps people feel a little more comfortable.
Mhm. Yeah. That's great. Man, I love what you've done. I'm so excited you shared all this with us. Thank you so much.
Yeah, you're welcome.
Okay, so, well, is there anything else that you can think of that you want to share or would be useful just for the acupuncturists to hear about, working in the hospital setting, or just anything that comes to mind that you want to
Yeah,
share with the acupuncture profession worldwide?
sure. I think the thing that I have really learned over time is
Mhm.
while the acupuncture is an important part of it, sometimes I also feel like that's just what gets me in the door.
Mhm.
And when you are working one-on-one with a patient in the hospital, sometimes it's the problem that they're in for, and the reason that you've been consulted even isn't really the main problem they're having right now. And sometimes through conversation, you can develop uh, that sense that there's something else under the surface that needs to be explored.
Mhm.
And so, like just today, I was working with a patient who was having intermittent chest pain. Wasn't having any chest pain when I went to see him. And
Mhm.
so I asked, well, how's your anxiety? And, on a scale of 0 to 10, he said it was about a 15. And so I was like, okay, what's going on here? And so that, helped me sort of focus my treatment, but then it also helped me focus my conversation. And as we talked, I realized this patient started sharing that he's really concerned about his job versus his health. And he's maybe at this point where he's going to have to decide, to make some hard decisions one way or the other. And while I didn't have a solution for him. I said, well, have you thought of something like FMLA that would give you some time to work on your health and sort of save your job? And he's like, yeah, I don't really know much about it. And I said, well, me either, but I bet one of our social workers would. So I walked out, talked to the nurse, she put in the social work consult. And so I was able to connect him with some resources that I think were going to be more helpful than probably the acupuncture.
Yeah, I love that. And that is something I super align with, because I tell the acupuncturist a lot that, listen, it's our job to help people, but that doesn't always mean through us giving them acupuncture.
Exactly.
And so that's like a perfect example right there.
Yeah, and in the hospital, there's so many needs a patient can have that they can't fulfill themselves. And it could be just a warm blanket or a glass of water. And so learning to really just learn how to take care of patients and help them with all of their needs. And sometimes you recognize, oh, that's not my job. I can't help you with that one, but I'll go get someone for you. I think that's really helpful. I think realizing that doing something is better than nothing. So when it comes to your acupuncture, you might not be able to do exactly the treatment you wanted to, or use some of your favorite points. Like in the hospital, my number one concern is patient safety. In the emergency room, I figured there's enough emergencies going on. I don't need to create any more. And so, what's the parameters I'm going to use for my treatments? And so I did all distal treatments. I used, arms, hands, legs, feet, ears, and scalp. I didn't do any points on anyone's chest or abdomen or their back. And it's not to say I couldn't, but there's so many unpredictable things that can happen. It was just like, wherever there's a vital organ, I'm going to make sure that I don't have any needles near it.
Yeah.
And, so if your practice has been based on doing back treatments, you got to realize, okay, this might not be the right setting for you. If you really enjoy that, if you really want to do all of the cupping and gua sha, things like that, you may be able to find ways to do it, but you really have to focus on what's important right now.
Yeah, I think that's a super great point. And it's just really flowing with the change and just the present moment, and not being so stuck. It's almost like, so I have had experiences with Western medicine where I find that they very much go by the book instead of being in the present moment, with the patient. And so that's almost like the same thing as an acupuncturist in that setting. You want to go with the present moment and not go by the books, what you've learned as much,
Yeah. One of the things that I've noticed is the way that different providers in the hospital interact with patients. And a lot of it is based on their role, but it's also based on their previous experience. And so you recognize that the patient's there for the care of the doctor, but they're not the ones that do most of the patient care. They don't do hardly any of it. The nurses are on the front lines. And then we work with people that are sort of at that same level as the doctor, physician's assistants, nurse practitioners, but their experiences are also very different than doctors. So in a sense, I find it's almost, the people you work with get what you're doing.
Yeah.
And I think sometimes maybe the doctors don't quite appreciate that as much, just because they don't see how your procedure is the same kind of caring that that's going on in Western medicine. But really, it all boils down to taking care of patients. It's all patient care. You're there because you want to help people feel better. And so I've been lucky to work with lots of nurse practitioners, and they're great because they have that nursing background. They understand what direct patient care is. And so they understand how some of these interventions can be really helpful. And they're also in that position where they're overseeing the care of the patient and can sort of direct you to help in that way.
Yeah, that makes a lot of sense. Yeah, nurses definitely do a lot in the hospital setting.
Yeah. Hopefully you're acupuncturing a lot of them. Yeah, I tried to. In the emergency department, I had a lot of opportunities, and if I didn't necessarily needle them because they had to be busy and doing things, I used a lot of press needles, like the INX needles or
Yep.
KHT beads or ear seeds, and I would use those as acupressure, and I treated, everybody. I would treat the security guard, and the next day I would have 2 more security guards showing up saying, "Hey, I heard you help Bob with his foot pain. What about my back?"
I love it. Yep.
And it's just another way of spreading the
Yep.
the message of the work that we do, and giving people that firsthand experience. One of the other things that I take advantage of at the hospital is treating family members. If a patient's family members are in the room and they want to experience acupuncture too, great. It falls more into that role of education, being that acupuncture ambassador, that you want everyone to experience this, and to recognize, this is like a quick demo for this patient. You want it to be effective, so you find out, like, do you have any pain or stress? If they're in there with their family member, they're probably under stress. So I do, a few ear needles, let them sit there and chill out and experience it. And by and large, most people really appreciate it and find it helpful. And I think that's the kind of planting the seeds that's going to keep, people exploring health options.
I totally agree. Yep. I just give without, any agenda, with no expectations, just give to be of service, and to help to heal the world,
Yeah. And, so in our hospital system, we have probably over a dozen outpatient clinics that we could refer patients to. But when I worked in the emergency department, I also recognized that many of the patients that come to the emergency department were from the local community, and it tended to be a little bit lower socioeconomic and probably couldn't afford or have insurance coverage for acupuncture at one of our clinics. So we also created a list of community clinics for the patients that we can hand out. So we sort of understand where they're coming from and try to help them with, whatever service makes sense, even if the hospital system itself doesn't directly benefit from it.
Exactly. I love it. We are very aligned.
Yeah.
I love it. I love it. So this has been amazing. I could continue talking, but it's been an hour.
So could I.
Well, maybe we'll do it again. If anything, let me know if anything, comes up in the hospital, or anything that you want to share, or any experience that you think would be helpful for just our profession to know about. Please let me know, because we really just need to continue to have conversations. You've really made me think about a lot, that I wouldn't have thought about, unless we chatted about, so it's so helpful. It's just really stimulating the collective consciousness, of the acupuncture profession.
Yeah.
So
And I think that was sort of an eye-opening piece for me was, you go to school, you're trained a certain way, and you think, I need to go out and create a clinic just like every other clinic.
Yeah.
And you realize that that's one model, that's one business model, but it's not the only one. And I think we can get creative. Like I said, I did house calls for a long time, and that was just another way of meeting patients where they are.
Yep. Yeah, exactly. Really, it's limitless what you can do. I always tell people, create whatever you want. Let's do it. You know?
Yeah. I think you just need a healthy sense of curiosity.
Yep.
And then, that ambition to sort of say, okay, I have this idea and it's time to make this one a reality.
Yep. And, with the mindset and the support, like we were talking about, you really can. You can do anything. It's really exciting. It's such an exciting time to be an acupuncturist, I think.
It is.
There's so much for us to learn and grow and innovate and pioneer, and it's limitless. So,
yeah.
Okay. Well, Adam, I've super appreciated this and loved chatting with you. So we'll do it again sometime.
Yeah, it was my pleasure. It was a lot of fun.
And I just want to acknowledge you, for all the incredible work that you've done in the Western world, bringing our medicine in and just spreading it and just, being a little acupuncture love warrior ambassador. Thank you. It's amazing. And I'm sure that you've helped, thousands of patients by this point, and the ripple effect of that is amazing, so thank you for all the amazing work that you've done.
Well, I'm just grateful that I can, continue to do this work.
Yeah.
Given the opportunity and to keep pushing things forward.
Yeah, I love it. Awesome. Well, it has been a massive pleasure and honor, and I'll post this up for everybody, and I'll chat with you again.
Sounds great.
Okay, thank you
All
so
right.
much, Adam.
Yep. Take care.
Bye.
Bye.